Okay, just a couple more things. We want to add some pearls that are also in the X-ray protocol. Obvious deformities of a forearm, wrist, ankle, come get the provider. Obviously, anything open, so if the skin's compromised over the area of the fracture, come get us and before you order anything. As far as rib X-rays, if they're tender anterior ribs, we don't want to do a chest. We want to specify right rib X-ray, and
With PA chest.
which is in the orders, right?
Is in
It'll
the
say
order,
right
yeah.
rib with PA chest. Anyone that's pregnant, obviously no X-rays. So even if they're 17 years old and they say they're not sexually active, you still need to be diligent and recommend a pregnancy test. I mean, that's provider specific, but you don't want to X-ray a pregnant female.
If there's a chance they're pregnant, go ahead and order the pregnancy test so that can be back so then the provider can get the X-ray going and already have that negative result.
And then chest X-rays. So no child under 12 is getting a chest X-ray for cough
For a front loading.
till they're examined. And then children under 5, we're not just doing routine X-rays without the provider coming in and taking a look.
Yeah, the only other places that can be tricky is if someone has shoulder pain. It can also be neck, especially kind of in their advanced ages. You can get some arthritis. So if it's high shoulder, consider adding the neck or asking the provider. And same thing with back and hip. So sometimes a hip can be coming from the back. And so sometimes, again, in advanced ages with arthritis, if you're thinking hip, you might order a lower back, a lumbar spine. And if you have any questions about those two, then just ask a provider.
Great.
Yeah, I think that hopefully that will help with some front loading, the appropriate orders. In general, remember if you're ordering a wrist, you're going to get one view of the hand, and if you're ordering an ankle, you're going to get one view of the foot. So we can maybe save them some radiation. However, if they do have hand pain, go ahead and order both. Or if they do have a point-specific area on the foot, you can order both. But in general, most of the time we keep it just one joint because you can open it up and expand and get kind of a little bit more broader view.
Great.
All right.